Welcome to Highlands Oncology. In this video, we're here to empower and educate you about your chemotherapy journey. We know this can be an overwhelming process, especially in the beginning. But at Highlands, we're dedicated to ensuring you're well prepared and supported every step of the way. Our goal is to provide you with the highest quality care so that you feel confident and informed throughout your treatment. Thank you for trusting us with your care. What is cancer? Cancer is a condition that occurs when cells in the body undergo mutations, causing them to divide uncontrollably. Chemotherapy works by targeting and destroying these rapidly dividing cells. However, cancer cells aren't the only fast-dividing cells in your body. Other cells, such as those in hair follicles, the gastrointestinal system, skin, and bone marrow, also divide quickly. As a result, chemotherapy affects these healthy cells too, which is why many side effects can occur. This non-specific targeting of fast-dividing cells is both the strength and the challenge of chemotherapy. Now let's discuss some side effects associated with chemotherapy. Bone marrow suppression. Bone marrow is spongy material inside your bones that produce all of your blood cells. It is responsible for producing your white blood cells, which are infection fighters, your red blood cells, which deliver oxygen throughout your body, and your platelets, which help you clot to prevent bleeding. The bone marrow is rapidly producing these cells to support your body. Unfortunately, the chemotherapy sees these fast-dividing cells as dangerous and begins to attack them. As blood cells naturally die off in your body, your bone marrow is unable to replace them, and this causes a drop in your blood counts. We monitor bone marrow suppression by reviewing your white blood cell count, your red blood cell count, and your platelets when you get your lab work done. This is why we obtain lab work frequently. When we look at your labs, we look at your white blood cell count, WBC, and your absolute neutrophil count, ANC. Your WBCs are your infection fighters and are a part of your immune system. The ANC is a crucial component of your white blood cells. When your WBC count is at its lowest point, it is called nadir. This often occurs about 10 to 14 days after your chemo treatment. During nadir, your ANC could be 0.5 to 1.0. When your ANC is this low, you are at a severe risk for infection. This means that your body is not capable of fighting off infections or illness. When your ANC is this low, we will often hold treatment. When your ANC is less than 1.0, it is very important for you to check your temperature daily. If it is 100.4 or greater, please call our clinic. If your ANC is low and you have signs of illness such as a new productive cough, unusual nausea, vomiting, diarrhea, or painful urination, please come in to be seen. We do not want this to be ignored. While your ANC is low, you need to protect yourself from any type of infection. Hand hygiene is very important. Wash your hands often. Stay away from anyone who is sick or may be sick. Avoid large crowds if possible. Do not eat any raw meats, such as sushi or rare steak. Thoroughly wash your fruits and vegetables before eating. If you have pets, do not clean up after them. Have someone else do it, because it may increase your risk for getting illnesses. If you have any questions or concerns, feel free to call the clinic. Before you start your chemotherapy treatments, we will send you home with a prescription for an antibiotic. Please get it filled. You will want it on hand just in case you start fevering or feeling ill when your ANC is low. Please allow 48 hours to process any medication refills. Do not wait until you have run out of your prescription to call the clinic. For controlled prescriptions, including pain medications, these can only be filled Monday through Friday, 8 a.m. to 5 p.m. during regular business hours. If you develop a fever, we ask that you call our clinic. This is very important. If it is after hours or weekend, please call the main clinic number and you will be connected to our on-call physician or nurse. Your red blood cells are responsible for carrying oxygen from your lungs throughout your body. In your lab work, we look at a value called HGB. This stands for hemoglobin. HGB is a molecule responsible for holding onto oxygen on the red blood cell. When your HGB count is low, you have anemia. Anemia, caused by chemotherapy, is temporary. You may feel tired, dizzy, or short of breath if your values drop. If your HGB drops below 7.0, you may be sent to the hospital for a blood transfusion. This will help replace your levels and improve your symptoms quickly. Your platelets are responsible for clotting and stopping bleeding. When your platelet level drops, your risk for bleeding increases. When your platelets drop below 75,000, treatment may be held. If they drop very low, such as to 10,000, you may be sent to the hospital for a platelet transfusion. When your platelets are low, it is important to remember that you are at an increased risk for bleeding. Please be cautious to avoid any heavy falls or accidents. If you do have a heavy fall or hit your head or have any other type of trauma, call our clinic immediately. When you are receiving chemotherapy, we ask that you avoid ibuprofen, aspirin, Aleve, Advil, and any over-the-counter NSAID pain medication. These medications can thin your blood and increase your risk for bleeding even further. We recommend you take acetaminophen for pain. If you notice any abnormal bleeding, such as nosebleeds that last for hours, blood in your urine, blood in your stools, or any unusual bleeding or excessive bruising, please call our clinic immediately so we can schedule you to be evaluated. Your skin cells are another type of cell in your body that are quickly replicating and can be attacked by the chemotherapy. Your skin may become more sensitive while receiving chemotherapy. You want to be mindful when you go out into the sun. Make sure you wear sun protective clothing and sunscreen. You want to be particularly mindful of the skin on your scalp, as it may be more sensitive to sun exposure. You want to take good care of your skin. Make sure that it's cleansed and moisturized. If you develop any rashes, please notify your care team. Chemotherapy can cause side effects in your digestive tract. Unfortunately, many people struggle with nausea and vomiting while on chemotherapy. Our goal is to make you as comfortable as possible throughout your treatment. We will do this by providing anti-nausea pre-medications in your IV before chemotherapy and sending you home with an anti-nausea prescription. Before you start your chemotherapy treatments, we will give you prescriptions for nausea medicines. It is important to take an anti-nausea pill at the first sign of nausea. If you take one nausea medicine and 15 minutes later you still feel nauseated, you can take the other type of nausea medicine. For example, if you take a Zofran and you still feel nauseated, you can go ahead and take a Compazine. If the medications you have at home are not helping with your nausea, please let us know. We have other medications that we can use to relieve your nausea that we can try. Another important symptom you may experience is diarrhea. Diarrhea is more often caused by chemotherapy irritating the intestinal mucosa. Please refer to the new patient booklet for instructions on how and when to take anti-diarrheal medication. If you are having diarrhea, it is important to keep your hydration up, as you can become dehydrated very quickly if you are having a lot of diarrhea. If you are having issues staying hydrated, you may want to come in and be seen and get some fluids. If you notice any changes in your stool, such as color change or blood in your stool, you need to let your doctor know. One of the most common side effects of chemotherapy is fatigue. You may notice a change in your energy. This differs from person to person. You may feel exhausted after receiving treatment. Your body is going through a lot. It's important to get the rest that you need. You may not feel fatigued until a few days after treatment. It is important not to give in to fatigue. You want to stay active as much as you can tolerate. If you give in to the fatigue, it often makes the fatigue even worse. You just want to stay lightly active. Walk around the house, walk around the block, do something to keep you moving. just as much as you can tolerate. This often helps improve fatigue. Listen to your body. If you need rest, take it. Only do what you can tolerate. Chemotherapy can affect fertility. If you are of childbearing age, you may want to discuss fertility options available to you with your oncologist before receiving treatment. Chemotherapy may cause infertility or birth defects. Do not become pregnant or get your partner pregnant while on chemotherapy. A cancer diagnosis is a huge diagnosis and life change. You may experience anxiety or depression concerning your diagnosis. Please, let us know if you're struggling with mood changes so we can help. We can refer you to support groups that are available, counselors, or provide medications if needed. Please, do not suffer in silence. We have many services available for you at Highlands Oncology. We have a spiritual care team that is available at the clinic if you'd like to meet with them, along with several spiritual care volunteers. For our Northwest Arkansas patients, Hope Cancer Resources is a wonderful resource for patients going through chemotherapy. They offer resources such as wigs and scarves for patients dealing with hair loss, transportation assistance, medication assistance, and many more. Every chemotherapy is different and has different side effects. Please reach out to your care team for any questions you have regarding your treatment. Please know that you will not have all side effects listed in your book. These are discussed to prepare you in case you do develop them. We hope that this video has helped prepare you for your chemotherapy treatment. It is our privilege to be here for you in this crucial time. Please do not hesitate to call the clinic with any questions you might have along the way. And thank you again for choosing Highlands Oncology Group.